Hello, my name is George Levendakis, and with this presentation, I aim to address the legal, ethical, and professional issues presented within the case surrounding Dr. Ling Chen, an intern newly rotated into rural Queensland, Dr. Johnson, a GP working in rural Queensland, and Bert, who is one of Dr. Johnson's patients. The key aspects to address are the breach of professional boundaries between the doctor and his patients, prescription of restricted drugs, and a substandard professional conduct. Additionally, the consequences for those involved will be discussed, and the importance of this case will be applied to my own professional development. The first point to be discussed is the clear breach of professional boundaries that is witnessed. The implications of this will be discussed shortly, but first, what are professional boundaries? Defined by the Good Medical Practice Code of Conduct, professional boundaries are the limits that define the relationship between a doctor and their patient. There are two separate instances of this occurring within the case. The first example, which is less explicit, is the barbecue that Dr. Johnson hosts upon Dr. Chen's arrival, where it's stated that a number of other people from town have also been invited. While it's not made outrightly clear, there is an implication that the relationships between Dr. Johnson and many of the townspeople extends beyond professional boundaries. The second example, however, is more explicit, and this is between Dr. Johnson and his patient, Bert. This personal relationship is made clear through their discussion of weekend plans together at the Bowls Club following an appointment in clinic. Ethically speaking, breaching of professional boundaries can lead to an inherent power imbalance between both the doctor and the patient, and the judgment of both parties may be affected. In the patient's case, the patient's autonomy may be affected if they feel pressured to accept one treatment that's been endorsed by the doctor over another which they may feel is more right for them. In the doctor's case, their clinical judgment may be skewed and management may serve less in the best interests of the patient and more in the self-interests of the doctor. It must be accepted, however, that when working in regions with small communities, it's almost impossible for this not to occur due to reduced anonymity where everybody knows each other. With regards to issues of professionalism, it is stated within the Code of Conduct, Article 3.14, that whenever possible, avoid providing medical care to anyone with whom you have a close personal relationship. Otherwise, there is a risk that the personal relationship affects clinical judgment, resulting in a lack of objectivity and putting both the patient and doctor at risk. This lack of objectivity may have contributed towards Dr. Johnson's actions, where Dr. Johnson completely disregards Dr. Chen's advice in pursuit of his own agenda. It is possible that, as Dr. Johnson knows Bert personally and has witnessed his experience with chronic pain, this may have caused him to believe that the best course of action is to continue prescribing codeine despite the risks posed by extended use and concurrent benzodiazepine usage. Despite Dr. Johnson's intentions, this compromises the care of the patient and puts him at risk, a risk which subsequently eventuates. In this case, following the Bowls Club on Saturday night, Bert was admitted to the emergency department the same night due to falling asleep at the wheel with a blood alcohol reading of 0.07. While this reading alone is greater than 0.05, which is the legal limit at which someone can drive a motor vehicle in Australia, it is unlikely that this alone would have caused him to fall asleep at the wheel. As mentioned in the case description, it is risky to combine opioids and benzodiazepines due to the risk of combined overdose, respiratory depression, and ultimately death. Additionally, it is risky to combine these drugs with alcohol as well, as this compounds its effects. This is something that Dr. Johnson should have known about, and additionally, Dr. Chen attempted to warn him about this risk. However, due to the timing of the incident, it is likely that Bert was drinking at the Bowls Club while Dr. Johnson was present, meaning that it is possible that Dr. Johnson was encouraging his patient to participate in this risky behavior. The next point to address from this case is that surrounding medical management, with particular regard to prescription of Schedule 8 medications and how Dr. Johnson has neglected to follow these methods, putting this patient and potentially others at risk. The law surrounding the prescription of Schedule 8 medications is outlined in the Health, Drugs and Poisons Regulation of 1996. In order to fill a prescription for Schedule 8 medications, key information from the patient must be acquired. The key information in question is shown on the slides. Pay particular attention to the bottom 2 points, as these are important in regards to this case. It is stated within the case that when assessing Bert, Dr. Chen found that Dr. Johnson had been prescribing codeine to Bert for over a year, which exceeds the time frame of 2 months, meaning that if Dr. Chen did intend to continue prescribing codeine for Bert, that a written report containing the patient's circumstances must be written to the chief executive for approval. Additionally, Dr. Chen had determined that there is concern that Bert is dependent on codeine due to his extended length of treatment. According to the Health Act of 1937, a drug-dependent person is one who A, as a result of repeated administrations to the person of controlled or restricted drugs or poisons, demonstrates impaired control or exhibits drug-seeking behavior that suggests impaired control over the person's continued use of controlled or restricted drugs or poisons, and B, who, when administered to the person of controlled or restricted drugs or poison ceases, suffers or is likely to suffer mental or physical distress or disorder. Based on the information given, despite Bert arriving at his appointment seeking his codeine prescription, Bert was willing to attempt non-pharmacological management of his pain, meaning that it is unlikely that Bert is exhibiting impaired control over the extended use of codeine. Therefore, it is difficult to confidently say that Bert has a dependence on codeine. From an ethical standpoint, there is a clear conflict in both doctors' views on what is considered to be in the best interests of the patient. For Dr. Johnson, he appears to solely focus on the chronic pain that Bert is experiencing and attempts to remedy this through prescription of strong analgesia. Dr. Chen appears to take a more holistic approach to care, recognizing the risk that Dr. Johnson's approach poses and adjusts her strategy accordingly. Despite Dr. Johnson's attempts to reduce the harm caused by Bert's chronic pain, he inadvertently puts him at risk of potential overdose and death as a result of the medications he has prescribed. While Dr. Chen's plan will likely result in a better outcome for Bert in the long term, there is the period of adjustment to which he becomes accustomed to the practices involved in non-pharmacological management of pain, such as mindfulness and cognitive behavioral therapy. This, along with the likely resurgence of pain when the medications are first withdrawn, likely would contribute to a difficult transition period for Bert, which may explain his willingness to revert to codeine as management when he sees Dr. Johnson next. From a professionalism viewpoint, as Dr. Johnson is a professional within his field, he holds a responsibility to the patients that he treats as well as the greater community. Within the Good Medical Practice Code of Conduct, it is stated that doctors have a duty to make the care of their patients their first concern and to practice medicine safely and effectively. They must be honest, ethical, and trustworthy. Additionally, doctors should be able to reflect on their practice, and they have a duty to keep their skills and knowledge up to date. In particular, certain aspects of this code of conduct apply directly to this case, including Article 3.2.2, which states that you should ensure you have adequate knowledge and skills to provide safe clinical care, and Article 3.2.11, which states that you should be able to consult and take advice from colleagues when it is appropriate. In this case, it is clear that when Dr. Chen confronts Dr. Johnson regarding his practices, that by allowing Bert to remain on benzodiazepines and opioids at the same time for an extended period of time, and also encouraging risky behavior with alcohol consumption, he either lacks the knowledge to provide safe clinical care, or he has actively put his patient under risk. Additionally, he refuses to take advice from his colleague, and according to the nurse's statement made in the first paragraph of the case, he is notorious for being stubborn and refusing to take input from others. Finally, the conduct that Dr. Johnson has displayed must be considered and actions should be decided based on the outcome. Bert may consider that due to the outcomes brought on by Dr. Johnson's practices that he is able to sue him for negligence. 4 elements must be present in order for it to be established that negligence has occurred, and these are that there must be a duty of care that is owed, there must be a breach in the standard of care that is expected, there must be a direct causation between the negligent act and the harm that has arisen from it, and there must be quantifiable damages to have resulted from the harm. In this case, as there is a doctor-patient relationship between Dr. Johnson and Bert, there is a duty of care that is owed. The standard of care that is expected is that of a reasonable and competent doctor when put into the same circumstances. In this case, it is established that a reasonable doctor should be aware of the risk that interaction between benzodiazepines and opioids poses, and the risk of dependence with extended use of opioids. This is exemplified by Dr. Chen's actions when she attempts to confront Dr. Johnson about this, and it is clear that Dr. Johnson continued to prescribe opioids despite being advised otherwise, and did not advise Bert to avoid alcohol consumption or avoid use of heavy machinery. As the risk of harm to Bert was foreseeable, as the interaction between these substances is well known and the risk is significant, and a reasonable person would have taken precautions as shown by Dr. Chen's actions, there is a clear breach of the standard of care. With regard to harm and causation, while Bert was involved in a motor vehicle accident as a direct result of Dr. Johnson's actions, it is clearly stated that Bert only suffered minor injury in the form of bruises as a result of this. As a result, it would be found that no harm has occurred in this instance, and as such, Dr. Johnson would not be found to be negligent from this alone. However, the argument can be made that Dr. Johnson has carried out unsatisfactory professional performance defined in the Health Practitioner Regulation National Law Act, or HPR-NLA, as knowledge, skill, or judgment possessed, or care exercised by the practitioner in the practice of the health profession in which the practitioner is registered, is below the standard reasonably expected of a health practitioner of an equivalent level of training or experience, due to his conduct. Additionally, his response to Dr. Chen after she advised him against his current conduct would be interpreted as him attempting to influence her practices, as he is a senior staff member in this situation, meaning that Dr. Johnson is also carrying out unprofessional conduct as well. Unprofessional conduct is defined in the HPR-NLA as professional conduct that is of a lesser standard than that which might be reasonably expected of the health practitioner by the public or the practitioner's professional peers. And one example of this is influencing or attempting to influence the conduct of another registered health practitioner in a way that may compromise patient care. In terms of how Dr. Chen should proceed, she has already attempted to advise Dr. Johnson about his actions, which are below the expected professional standards. Therefore, the next step would be to report Dr. Johnson to a governing body regarding his actions. In this instance, following the flowchart on the slide, it can be determined that Dr. Chen must notify the Office of the Health Ombudsman by making a mandatory notification due to a significant departure from the professional standard. There is a definite departure from the accepted standards, as in this case, efforts should have been made to avoid opioid treatment due to the interaction with other medication and the risk that they pose. This departure evidently puts the public at risk of harm in several ways. Based on Bert's case individually, he caused a single vehicle accident due to falling asleep at the wheel under a combination of both medications and alcohol. While only minor injuries resulted from this incident, the potential for serious harm to himself, as well as potentially involving other vehicles or pedestrians if a similar incident were to occur, is both present and significant. Additionally, the risk of overdose leading to death in these instances is also high, which is why this practice is not recommended. Additionally, the risk is significant due to several factors. Dr. Johnson works in private practice with only 2 other doctors in the same town, and is a primary care provider, meaning that Dr. Johnson sees a large number of patients from the community, and his actions cannot be held accountable by other team members, other than Dr. Chen in this case. Dr. Chen works in the same profession as Dr. Johnson, and although she's at a lower level of experience, she can still adequately determine that Dr. Johnson's actions depart from the professional standard. It is clear that Dr. Johnson shows no intention to address his own practices when confronted about them, and there is no evidence that Dr. Johnson has reflected on his own actions either. As mentioned previously, the risk of harm to his patients is great. While only one patient is mentioned in this case description, there is potential that several of Dr. Johnson's patients are also being managed in a similar manner. Once the Office of the Health Ombudsman have been notified, the consequences of Dr. Johnson's actions will likely be up to the discretion of QCAT, as due to the unsatisfactory professional performance and unprofessional conduct, it will be considered as a serious complaint. The range of penalties that can be imposed by QCAT are listed on the slide shown. Additionally, for not complying with the correct procedures for prescription of Schedule 8 medications, Dr. Johnson faces a penalty of up to 60 penalty units. In Bert's case, he unfortunately would not be able to claim negligence against Dr. Johnson, and furthermore, he would have to be reprimanded for his intoxication behind the wheel. There is no indication whether he's been found to be driving under the influence of alcohol previously, but assuming that this is his first time, this would likely result in a 1 to 9 month suspension of his license and a maximum $1,868 fine. Regarding the importance of this case to my professional development, the various themes presented within this case act well to illustrate the interplay between the law and the ethical decision-making that must be made. It is likely that in the eyes of Dr. Johnson, his method of treatment was keeping with the best interests of the patient, and it goes to show how even actions with good intentions can result in disastrous outcomes. This additionally showcases how vital it is to remain up to date with clinical knowledge and how important this is for patient care. Medicine is an ever-evolving field, and what is accepted practice one day can be found to be detrimental the next. Lastly, this case helps to give an insight into the challenges of rural medicine. These issues, such as close-knit communities that slowly blurs professional boundaries, or issues with resources and allocation, as shown in the case as there's only 10 beds in this hospital and 3 doctors staffing it, and that supplies an entire town. These challenges shift perception of medicine over time, as well as adaptation of our practice to suit the rural lifestyle. Thank you for watching my presentation.